Mary, when you talk about these developments, can an individual physician somewhere say, all right, listen, Mary, this sounds like an incredible thing, and Dr. Such and Such in Fort Lauderdale, Florida says, yeah, I want to be part of this, or is it only bigger groups?
Well, that's an interesting question because physicians could use this, but they are, unless you change the rules of the game, they're not going to have the time to use this. And there was a man, Ken Melman at Stanford, who started a company, Socrates, about the same time we started MedExpert. He was distilling information for the physician, we for the consumer, and we're existing and thriving, and they sort of stalled out, or I'm not even sure if they're even around. But the problem is that the physicians, if they see 18 to 30 patients a day, they don't have the time. And the one with the most vested interest in their care is the individual. And in the type of data we provide them, we will then what we call triangulate. We will work with the patient, and then in turn we will always include the treating physician in the process. Treating physicians love our information and because that's what they went to med school on. It's just that it's today's information. When you go to a doctor, very often the dissemination of information lags discovery by 7 to 17 years.
Wow. Well, it's a fascinating thing when you take a look at this. You factor in all of these things that many medical practices these days, unfortunately, are run. It's an in and out sort of thing. As you point out, it's 2 or 3 minutes. It's a very quick appraisal of what your symptoms are, but then you factor in the litigious nature of society, and you're getting over-tested. I mean, you've got a lot of physicians, as you know, ordering tests that, frankly, they don't necessarily feel that they need to, but boy, they've got to protect themselves against lawsuits.
Right. Exactly.
You don't want this guy on here?
All right, so where do we go with this, Mary? You've got this thing that can, according to your studies, then cut the cost by almost 16%. And we've got folks in D.C. saying, no, what we need is the same people that give you the DMV and the post office will come in and solve all of your problems and make your health care efficient. Where do we go? What do we do?
But not under our name.
We're pretty conservative in our approach to business, and we've worked to get involved with Medicare and some of the government entities to get a bigger test bed of what we're doing. I mean, we're pretty convinced it'll work. It's worked for 5,000 member groups, 10,000, 60,000, 130,000. So that adds up, and we're not seeing cherry picking or any kind of aberrations that go on.
Right.
So where we go from here is to get bigger groups, and I should say that, I mean, you're more involved with the politics. We've got our head down trying to find a solution.